Hi, my name is Robin Maril, and I'm a Senior Legislative Counsel here at the Human Rights Campaign. And I am joined today by Matt Heinz, who is the Director of Provider and LGBT Outreach at the U.S. Department of Health and Human Services in the Office of the Secretary. And I'm thrilled to have Matt here today to answer a couple of questions and take questions from you all as well. So it's been a year since the landmark United States Supreme Court decision in U.S. v. Windsor, which for the first time opened up federal benefits to LGBT couples across the country. But I think folks are often a little bit unsure of which federal benefits are open to them if they, for example, live in a state that does not recognize their marriage. We're also having more states come on board, it seems like every week or every month, with marriage equality. So what does this mean for the LGBT community when it comes to their health and when it comes to actual ACA enrollment?
Absolutely, great questions, Robin. And with the Affordable Care Act, the LGBT community really has a lot of opportunities to start to really address so many of those health disparities that affect our community, like smoking, like obesity, like certain types of high rates of cancer and depression and suicide rates, also very disturbing things. But now with the Affordable Care Act and with the opportunities that are going to be available now for so many same-sex couples as more and more states come into the fold and start recognizing equality in marriage, as you said, there's a lot of options available to them in the Affordable Care Act, and I think it's really important that people recognize that.
So for families that are living in states that might not recognize their marriage, does the Affordable Care Act have any protections built into it, or are they sort of stuck if their state doesn't recognize their marriage or provide them protections?
That is another great question, and it's really confusing for a lot of people, but the Secretary of Health and Human Services and this administration have made decisions that make sure to protect the rights of legally married same-sex couples regardless of where they're living. And so that means as long as they were legally married somewhere where that can be legally done, where that can be celebrated, even if you are in Massachusetts and then choose for whatever reason you and your spouse to move to Texas, where right now we don't have marriage equality, even in those circumstances, when applying for financial assistance through the Affordable Care Act marketplaces that are now available to the community, they will be treated just like and offered plans just like any opposite sex couple.
Oh, great. And I think something else that often people wonder about is, if folks have been turned away before, sometimes they don't feel like they want to go ahead and try to reapply for health insurance through the marketplace. Are there currently any protections for folks based on, for example, HIV status is something that we really hear about as far as coverage?
That's one of the main reasons the Affordable Care Act came into existence, to help protect patients, all patients, including LGBT individuals, from those kinds of really discriminatory behaviors by insurance companies. None of that's allowable. And thanks to the Affordable Care Act and those specific patient protections within that new law, it's not possible to use anything in a person's health status against them to either charge them more, so just because you happen to be a lesbian or transgender or bisexual or gay, you can't have a higher rate charged to you. And if you happen to have cancer a long time ago but are fine, or had high blood pressure or chronic back pain or anything else wrong with you, none of that can be used. Those pre-existing conditions cannot be used to make you pay higher rates or prevent you from getting coverage at all, which is another really amazing effect for specifically our community.
And for folks living with HIV today, I'm sure as a doctor, just the monthly cost of HIV medication is out of control.
Yep,
so
very high.
Can insurance companies put any sort of lifetime cap or anything? Because I think that what we've heard from people before is they sort of hit a wall and the insurance company refuses to pay more.
And they're getting their stock, right?
Exactly.
And that is also thankfully not allowable. Both there's no lifetime caps, and there's also no annual limits, because that was another problem that they'd hit the cap sometime during a year, and then they would have to pay out of pocket for the rest of the year. That's no longer acceptable. And so again, for our community specifically, especially anyone suffering with a chronic illness of any kind, HIV, AIDS, cancers, a variety of illnesses, that is really helpful that there are no lifetime or annual limits.
So if someone feels like they have been discriminated against even though they shouldn't be, are there steps that they can take or that HHS can take to sort of, that HHS can take to respond to those complaints?
Absolutely, and that's one thing that our Office of Civil Rights at the Department of Health and Human Services is tasked specifically with tracking, and I'm going to talk a little bit about the protections within the Affordable Care Act for LGBT, for the community. The first one is in federal statute, and I know it's going to be a little wonky, but it's Section 1557 of the Affordable Care Act. But basically what that says is, for any type of, it protects against discrimination based on sex stereotyping or gender identity. And so that is in federal law, and that's rules as to how that's going to be enforced and monitored by the Office of Civil Rights are currently being drafted up and pulled together. So we'll see soon a little more specifics on that.
That's great.
But two other specific layers of protection, the essential health benefits package. That means the 10 basic things that any health insurance plan in the marketplace or outside of the marketplace must offer, including, for example, hospitalization or maternity care or prescription drug benefit, those kinds of things. Within the rules that govern those health benefits and those essential benefits, there's a layer of protection against anyone being discriminated against as who is part of our community. And then the third layer is the specific requirement on these, what they're called qualified health plans, so that any plan that is able to sell a product in these marketplaces, they are specifically prohibited from discriminating against people based on sexual identity, sexual orientation or gender identity, which is fantastic and really unprecedented.
That's great. And you mentioned sort of the portability of these benefits regardless of where folks live, based on, if you're married in Massachusetts but relocate to Texas, then the ACA and HHS will still recognize you as married, which is great.
That's right.
But what about folks that maybe their state has just passed marriage equality? How do they fit into the whole ACA puzzle?
That's a great question, and I will say that we, the federal government, will recognize folks as legally married, and in this case, for the purposes of that example, for the purposes of applying for health care, but obviously the state of Texas would still not, unfortunately, recognize someone, just to be clear. But in terms of someone, say, in our next state, we'll be on 20, right? 19 or 20?
19 in the District of Columbia as of June, yeah.
Fantastic. So and whatever state is next, very likely is going to happen, we hope, outside what's called the open enrollment period, which is the time frame that we just ended in the middle of April from this past time, where people could just jump into any marketplace plan wherever they lived. That has closed, but because so many people are now able to get married, and it's very possible they're going to do that right away or very shortly after their state legalizes same-sex marriage in their state, that's something that would cause what's called a special enrollment period. That's a qualifying life event, is the insurance term for it. And that just means that you get 60 days of your own, just for your family, 60 days to go ahead and shop on the marketplaces and jump into a plan.
And they can just do that online?
That is exactly right. If you go to healthcare.gov, they'll be able to see what is a qualifying life event, what counts as a trigger to allow me and my family to jump into a plan. There's a few other things too, and I think becoming age 26, that's an interesting one that people have to think about, because now your family plans have to include young adults up to the age of 25, so just becoming 26 means you are going to, of course, lose very likely that coverage, and then you can go and look for some more, or graduating from university or college degrees. Sometimes you lose university coverage, and or maybe even adopting a child or childbirth right there. That's a change in family composition, which will allow you to have an open enrollment.
And I think we know that a lot of LGBT people, this is going to be their first chance to get insurance.
That's right.
So is there anybody that they can call as they're sort of going through the process?
Sure, and that's so 1-800-318-2596. Even though we're not in open enrollment right now, you can still talk to the call center, because there's a lot of people that do qualify for these special enrollment periods. You can call and ask them. You can go to healthcare.gov, and there's a great tool that can take you through what those circumstances are, and really help to define things for you. And even better, for folks like you're mentioning that have maybe never had health insurance ever, because that's where we're doing our best to help those who have been uninsured, and sometimes they're families and grandfathers, and no one has been insured. So just teaching them about basic stuff. What's a premium? What's a deductible? What is out-of-pocket cost?
Right.
And why am I paying into something and not really getting anything back on a month-to-month basis? That's a strange concept if no one has ever done that, right?
Yep.
So for those families specifically, healthcare.gov and our call center have resources there to help them get through the process of getting a primary care provider. Because as you know, we in the LGBT community have are less likely to have like a medical home, less likely to have a provider, a physician, a nurse practitioner, someone that we go to regularly for our needs. And also we're more likely to lack health insurance. And one thing I do want to dispel is that stereotype that our community is more affluent somehow. And that's just not true. And you know that just as well as I do, but it's really important for your listeners to hear that the LGBT community is actually disproportionately lower income, which means in those states that are expanding Medicaid, the health insurance for lower income folks, that's going to help our community just even more.
And for folks that might have a more complicated medical history, whether it's HIV or another sort of chronic illness, how do they shop for a plan that's right for them? And would the same folks be available to them to sort of help them go through it?
Certainly. In addition to the folks at the call center, and again, 1-800-318-2596, you can go to healthcare.gov and find local help. There are actually agents and brokers and certified application counselors, is the fancy thing we call them, but basically in-person assistance with a living, breathing human who can actually sit across from them and help them go through and really answer a lot of these questions. Because in those cases, especially for people on a specific medication regimen, and I'm thinking of those who have HIV, it's very important not to mess around with that specific set of medications they're taking. And so that's why at healthcare.gov you can actually kind of delve into the plans and dig around to make sure that you're not somehow getting into an option that eliminates some of the medications you need covered, or they're covered but they're covered so expensively it actually would be worse off for you. And that's something that we've been working with all the operating divisions at HHS, HRSA especially, because they deal with Ryan White and the various other programs specific to HIV, just making sure that they understand that yes, you could have some great benefit from the Affordable Care Act, but let's look closely. And also for Medicaid. In some cases, folks on Ryan White are going to be more and more now qualifying for Medicaid, and that's going to have our CMS, the Center for Medicare and Medicaid Services, working more closely with HRSA as well to make sure that care that might be transitioning back and forth between Ryan White and Medicaid is done smoothly.
Okay, great.
Yeah.
So you mentioned that the LGBT community, in addition to being lower income, is at a higher risk for illnesses like obesity and certain types of cancer, as well as increased tobacco use. What does the ACA offer folks as far as improving their overall health?
One of the great things about the Affordable Care Act is that it has a lot of prevention and wellness components, and that is that in whatever metal level of plan that you choose to get through the marketplace, you will have almost all prevention and wellness services, screenings, for example, certain blood tests to check cholesterol, or counseling on weight management, perhaps with your primary care provider, various other screenings, will be no additional cost, meaning it's going to be included in the premium that you're paying month to month. And that is a particular benefit for our community, considering those disparities that you just listed, because a lot of these diseases can be prevented or can be controlled in a much, much better and more cost-effective way that has less negative impact on the patients. And so that's really one of the goals of the Affordable Care Act.
That's great. And do you have any sort of takeaways about the ACA, about maybe misconceptions around the ACA that you'd like the HRC community to know before you head out?
Absolutely. And one of the things, as we've actually been traveling around the country, meeting in LGBT community centers, in fact, just recently in Tulsa, which was a great event, we have noticed that while people generally know a bit about the Affordable Care Act, website issues early on, of course, made it very popular on the late night shows, which is fine. But we have noticed that while people do understand that, okay, now there's a requirement to get some kind of healthcare coverage, not sure how that works, but they know that's there. They know there might be a penalty if they don't, which a lot of people actually could potentially not even have to pay because there's hardship exemptions. But people don't really seem to understand that for the vast majority of folks who are applying through the marketplace for some coverage who are uninsured right now, 80+% of them are going to qualify for some, in some cases, very significant financial assistance. And so the numbers they're seeing on the website may not actually reflect what they ultimately are going to be paying on a month-to-month basis, and that there's also some ability for lower income folks to get assistance paying what's called cost-sharing expenses. So if your copay to see the doctor is $100, well, if you're lower income, maybe 65 of that is actually paid for in a different way, so that you only have to be paying a smaller portion. And so there's a lot of people just don't understand. They know they have to get health coverage, but they don't know that there's a lot of financial assistance available to help them afford it.
To make that possible.
Exactly.
So, I think everyone's pretty familiar with healthcare.gov. Are there any other, additional resources that HHS has put out that folks can look at, or any other documents?
Yes, absolutely. There actually are a few things that we have just redone, and one of them is just an LGBT-specific fact sheet that goes through a lot of these details that we've talked about here today. And actually, there's a couple of those, and those are available at hhs.gov. And during the outside of the open enrollment period, there's actually some resources that we have just pulled together to really help to educate the community and your members and your viewers, hopefully, about the special enrollment opportunities that we talked about a little bit earlier. And that is, if you have a baby, if you adopt a child, if you are newly married in a state that has just recognized same-sex marriage, finally, those things prompt those 60-day open enrollment, or specific open enrollment periods just for that family. And where there's a few graphics that we've just put out to share with you, to have you share with your membership, and hopefully spread all over the place to make sure that people know what their opportunities are.
So thank you so much for coming today. I think this has been super helpful and useful for our members, and we'll look forward to feedback, and I'm sure that HRC and HHS are more than open to answer any questions folks have as they navigate the system.
Absolutely. Thanks for having me, Robin.
Thanks.